That's when the guidelines aren't followed that it becomes pretty problematic. Nancy Liu reporting there. I want to bring in Dr. Monica Gandhi. She's the professor of medicine and associate division chief of the Division of HIV, Infectious Diseases and Global Medicine at the University of California, San Francisco. You know, as I hear this, there are a lot of people doing it. I've never done it, but it doesn't sound safe. What's your medical opinion on these vampire facials?
Well, it does involve needles. So anything that involves needles can pass on blood-borne pathogens. So clearly what happened here is supposedly you're using the blood from the patient themselves. I'm using patient because unfortunately 5 people did convert to HIV, so they are patients now. But the needles must have been contaminated with other people's blood for this contamination to occur. So anything that involves needles needs to be really safe, absolutely clean needles, dipping into, common water supplies that are clean. I'm not sure what happened here, but clearly practicing without a medical license or without a license did not work out.
Right. So begs the question, what questions should people be asking before they get a procedure? Where is it safe to get something like this done? What would be top of mind?
Yes, I mean, that place, because we've also seen, for example, hepatitis C infection from nail salons, which is another blood-borne pathogen. So you want to ensure that there are signs on the door that this is an inspected facility and that the practitioners there have undergone training for blood-borne pathogens and how you prevent the spread of blood-borne pathogens. So training, certificates, ask to see their license. It looks like this is here to stay. So if that's true and you really want to do this, please ensure that you're going to a very licensed and clean facility.
And this is the injection of platelets, a person's own blood. Could the same risks be true in something like Botox, which is also very common using needles?
Botox is drawn up from actually what Botox is, it's from a spore called Clostridium botulinum, and there's no blood in there. So we've never seen any problems with Botox injections, and I wouldn't expect that to happen because there's not exposure to blood.
Okay, but even if there's a needle involved and the needle hasn't been handled
properly?
Needle
has to be clean.
Okay.
You're
always.
absolutely right. Needle has to be clean.
Yeah. Another health story, this involving the brain. Researchers trying to get to the bottom of why certain people are more likely to believe conspiracy theories. A new study analyzed the roles of motivation and personality, and the author said that conspiracy theorists are not all likely to be simple-minded, mentally unwell folks. The researchers found that people who trusted their intuition felt that they were superior to others. I think given the pandemic, maybe, we saw a lot of conspiracies arise. You, as a doctor, received lots of questions from people. Does this surprise you at all, this new research?
No, it's really interesting because I don't think it's just what these researchers are saying is it's not just that you're motivated, you're upset, like, let's say, by the pandemic, but there's a certain personality trait where you find yourself, that you're much smarter than people, you feel superior, and that you feel that you can evaluate the situation differently. So example is 9/11, thinking that was set up by the US government. That's a conspiracy theory where you think you have clues that other people don't. I think what happened during the pandemic is that there was a lot that was problematic, and we didn't have clear messaging, and yet there was like obvious truisms in the pandemic, like vaccines work, but everyone was so upset that personality types that were more prone to conspiracy theories came out with conspiracy theories like 5G or you're tracking someone with the vaccine. Those were the kind of conspiracy theories that came out during the pandemic.
Right. I'm sure you get some pretty wild questions in your profession about all
yes.
things. You and I have talked about RSV a number of times, Dr. Gandhi. The FDA has approved the first RSV drug to protect babies from the virus. It's called Beyfortus. Tell us more about this.
Yeah, this is very exciting to me that this happened yesterday. So if you think about who's at risk for respiratory syncytial virus, RSV, it's elderly, and we're going to have a vaccine by the fall for those over 60, and it's those less than 6 months. So infants, neonates, especially premature infants, and those who are born with immunocompromise. So we have a lot of hospitalizations in very young neonates from RSV. It's really dangerous, can be for that population. And what Beyfortus is, it's not a vaccine. It's a monoclonal antibody.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.